Hi, I'm Susan Bratton, intimacy wellness expert from the 20, and I'm here with my friend, Dr. Robyn Benson. She's with Santa Fe Soul Center for Optimal Health, and what we're talking about is hair restoration. By that I mean using your body's own healing ability to regrow more hair, especially in midlife and beyond, when both really people across the gender spectrum start to see thinning, balding, etc. There are some things that you can do, and one of them is using PRP. So Dr. Robyn's going to talk to us about the vampire hair lift and hair lift and hair restoration. So tell us how it works, and then I want to ask you all about the procedure.
Okay. Well, so first of all, let's go over why would people lose hair, right? So a lot of it could be like a massive stressful event. That's very common. Women who are perimenopausal or menopausal, it just happens with aging, right? But there's also the detective work that's often necessary. Like when a young person comes in and it's like, oh my God, my hair's falling out. Or I've got this big patch, this little circle or two. I've seen that where, in two cases where people lived in a moldy home. And that was stressing out their immune system. We also look at food sensitivities, like allergies.
Gluten.
Can affect.
No B vitamin absorption.
Because
ruins your gut.
Exactly. So if your gut is compromised, then all your systems in your body are compromised. So infection, we talked a little bit about that. All this geopathic stress, like all this artificial lights and computers and phones that we're exposed to, where those are frequencies that we are not designed for. So
geopathic.
Yes.
That's a new word I hadn't heard. I like it.
Yeah, electromagnetic pollution. You hear lots of different issues. There's also genetics, right? We don't want to. We cannot not look at the genetic piece here, because when men have dads that have lost hair young in life, very often they have that condition. So this is where this particular procedure is not necessarily going to work. So hormones I mentioned, and also the levels of toxicity. So those are the main underlying causes of hair loss. So we look at micronutrient deficiencies too. So to have a healthy head of hair, you want to be not deficient. You want to maximize. You want to get the best levels of zinc, magnesium, vitamin D, even nitric oxide, right? That's really important. People who are anemic,
you can't get the blood flow to your hair follicles if you don't have enough nitric oxide production.
We see a lot of women that are menstruating that are anemic, and that
no iron.
No iron is an issue. So after doing all of that kind of preliminary work, we then say, you're a great candidate for the hair lift.
Okay.
Or you're not, right? So we can, and then we want to look and see, well, where does the pattern that's happening? Where's a lot of women, when they're menopausal, all of a sudden they just
receding temples.
Right, they do. Or they have this part where it's just falling out more up here. And then there's some women that they're just like, wow, it's all back here. So wherever it is, and that what we do is we do a little bit of skin pen. We haven't talked about face when I go into the face area, but we do this microdermal needling called the skin pen. So especially when there's a receding hairline, we go into that area where we get to cause all these little openings, literally, where we put some of that platelet-rich plasma right in there to activate dormant cells, right, to activate circulation, new blood vessels. And that's very exciting. So we can do that area with the skin pen. This is just where we stack. This is not common with hair lifts, but it's what we do. And especially if a woman or a man has a couple bald areas, want to find out what that really is, but then we can go in with the skin pen and you really activate, again, that whole area. And a lot of times it bleeds a little bit, and we want that. Then we add the PRP right on top.
How's the PRP get into those holes?
So because with the skin pen, it's a microderma needling. You're actually causing...
Are you putting the PRP on and then punching it into the skin, or are you punching the skin and then putting it on?
That's what we do. We punch the skin, then we do the PRP.
And how does it get in there?
It gets in there because it's immediate. As soon as you do the skin pen, you're causing some blood. It's actually bleeding a little bit.
Yeah.
And then, so those lots of little micro holes, lots. Especially like when we do the face, the whole face, we do the skin pen on the entire face. So we're helping again with that collagen and elastin and to peel off that layer of damaged skin or brown spots we see, or scar tissue, all of that. So getting back to a hair lift, we do the skin pen in those areas, and then we find out, because we get about the 10 cc, so we have to be very strategic as to where it's going. We have really loved over the last 3 years to do a carousel to make it less uncomfortable, like to where we actually have 8 needles going into the scalp at one time.
Okay.
And we do use a BLT cream that helps to numb the area, because the scalp is a very sensitive area.
Yeah.
But we have found ways to make it much more pleasant.
Okay, so the first thing that you're doing is you're drawing my blood, you're putting it in a centrifuge, and then you're pulling out the platelet-rich plasma. Are you also keeping the platelet-poor plasma? Do you use that as well in the procedure for hair restoration?
We do. When not during the actual procedure, we give our patients their own platelet-poor plasma. They can take it home, they can use it on their face. For the first 24 hours, 48 hours, it's very biologically active. It's full of the goodness of nature.
Yeah.
And you can also keep putting it on your head, because when people they bleed a little bit when they get the hair lift, that we say don't shower for the first 3 or 4 hours. Right? Just let it sit there and do its goodness. And then later on, add some PP, platelet-poor plasma, to that area when you go to bed at night, and then again in the morning. And it's fantastic because it's just, biologically active substance that helps with this regeneration.
Okay, so the first thing you're doing is, on a hair restoration, it's not just taking one needle and sticking it into the scalp. What you're doing is you've got this pen with 8 little needles. Is that what it is?
There's 2 things. So if we do the skin pen on this receding hairline,
so in the bald spots.
And the bald spot, we do this microderma needling first. And then if that's not an issue, then we just use like this little carousel where you have 8 needles, and then we put the PRP into those 8 needles. Like when I push the syringe, it goes to those 8 needles. So we get 8 points at one time, and then we move that carousel around to where the problem areas are.
Okay. Yeah. And I've had Botox, and when they put the needle into your forehead, that there's kind of this crunchy sound, because there's not a lot of fat, so it's not like you're injecting into fatty tissue. You're injecting into skin and then something and then bone. There's bone, so you're not going down to bone. You're going subcutaneously into that layer of tissue between the skin and the bone. What's that layer called?
In the scalp?
Yeah.
Good question. Anyway, all I can say is it does crunch.
So it
does
all
crunch.
8 are crunching.
It's just the dermis, the dermal layer of the scalp.
Yeah.
And it is intense. And it has this great impact on, again, awakening dormant skin cells that have not been producing. The hair follicles have been shut down. Yeah.
So that micro damage is reawakening the cells in that area of damage to start fixing and healing the trauma that's happened. And then you're kind of turbocharging that damage by putting the PRP in there so that it calls to more growth factors.
Exactly.
Okay.
Yeah.
So how long does it usually take to do the 8 carousel pen over the whole area?
Oh, goodness. Less than 5 minutes.
Oh, so it's pretty fast. You're just kind of going, doom, doom,
and it's,
doom,
again, rather than doing 8 individual injections, just doing it all at once is a lot.
So you're getting it done fast, but it hurts like hell. What do you do to keep it from hurting so much? Do
Well,
you
the
put
BLT, the benzocaine, lidocaine,
so you're numbing.
Yeah, we do. We numb
You're
it.
numbing the whole head.
Yeah.
Okay, good. So then it's like this kind of like oily, gloopy mess, and then you're sticking the little 8 pens in there.
Exactly.
Okay. And then do you do the micro needling around the kind of receding parts at the end?
Yes.
Okay.
Especially if that is a problem area. Yeah. And this is a type of PRP that is good to do more than once.
Yeah. You kind of have to build
Yeah,
it
most
up, don't
people
you?
will, if you're creating a massive shift right in that area the first time, but if 6 weeks later you do it again, that's a good thing with the PRP. But we also add ozone.
Tell me about that.
Ozone.
Is it prolozone or ozone?
No, just straight
up ozone.
So very often, especially our patients that live right in Santa Fe, we have them come like once a week. Instead of doing the PRP, to go into those problem areas with ozone.
How do you do that? Needle?
With a needle.
And
it's a certain strength, and we have to do a certain, it's called gamma.
Gamma.
You definitely want somebody who's well versed in using ozone. It's incredibly regenerative. So you've already had this active.
It's an antioxidant.
It is, and it increases oxygen, right? It increases the oxygen turnover into this healthy, regenerative area that's been activated by the PRP a week before. And what we do is we often will cover up the eyes because the ozone gas can travel, but we go again to those problem areas, and it's very quick. But you can feel it, like people are like, wow, I feel a lot of life force going into that area. Right. Ozone is phenomenal.
I love ozone.
It is a kind of a staple. It's a big part of almost every regenerative procedure that we do. And getting back to the O shots and the P shots, with certain situations with scar tissue, I could just I want to do a little PRP and ozone. The lichen sclerosis, a little bit of ozone is so effective because we're looking at a pathogenic influence, right? So if ozone is helping sweep out ponds like that are full of crapola, right? When it's just overtaken, and pools for that matter are now being sanitized with ozone. You can imagine what it's doing in our body. And for that proliferative, that regenerative effect, when we can go into the different tissues that we're using with PRP and then stack ozone.
That makes sense.
Yeah.
So what would be generally let's just say there's a woman who has thinning hair, and you can kind of begin to see her scalp, and her mother had that problem and her aunts had that problem, and so she's like, oh boy, I can see I'm getting thin, I better do something about it. And or the guy who is thinning, receding hairline, he's got a bald spot in the top, and he's like, oh man. What can you expect from the masculine versus the feminine? Because we have a different biology around hair loss. What are you seeing out there when you are doing these therapies? I wouldn't imagine that you're going to say to a guy, hey, I can reverse your baldness. You can't do that. But what kinds of effect can you get, and how many treatments if you could just do what you need to do, and people would come in and get what you want them to get, what would it be for the masculine and what would it be for the feminine?
I want to mention a very important blood test that measures DHT. Have you heard about that? Right? So people that if they have that elevated, then we know that there is a hormonal issue going on in the body. So that needs to be corrected, because that's just going to undermine anything that we're doing. And why have people waste their money? Right? So that's really important to know.
And then what do? You manage the DHT with natural things like saw palmetto and other supplements to manage that, or
right? Sometimes we look at estrogen dominance as an issue, or we look at testosterone pathways. We have to look, or too much of a good thing. We don't need that either. So we got to find out where this is coming from. Bad foods, plastics. There's lots of different things that can elevate that. So we again, one of the most important things with both men and women is to find out those micronutrient deficiencies, because that's essential, and to even get the hormones to work. We also want to look at parasites and bacterial overgrowth and fungal overgrowth, even when we're talking about hair, because that's an organ system in our body. Our thyroid's underacting or overacting thyroids can radically affect our hair. So women that know that, wow, I don't want to be like my mom. I'm one of those people, actually.
Really?
My mother has very, very thin hair. So she lives in Florida, so she got her PRP there, and I'm sending her a bunch of supplements because I was able to determine magnesium deficiency, zinc deficiency, glutathione, changing her hair products, crapola, right? That hair products really
full of toxins
matter.
Yeah,
right. You want to get there's just way better choices out there. Even at night, just putting sesame oil on your scalp.
Or castor oil.
Castor oil is fantastic, as is just coconut oil, right? And then also rosemary oil is specifically good for head hair.
Yeah, I've heard rose hip as well.
Yes, and when you mix that with a carrier oil and you just like let it just saturate, your scalp, and learning to massage
getting
your
the blood
scalp.
flow. Like you said,
yes.
the nitric oxide is one thing, but head massage is really important.
Yeah. And we like to do pulse electromagnetic field technology. We like people to have things in their home. I know you are in favor of a product for hair growth, but to have pulse electromagnetic field system in your home. I mean, there's the IMRS that we have, intelligent magnetic resonance stimulation. A lot of our patients have it 24/7. So you have this goodness of life that's mimicking nature, that's positively impacting every single cell in your body. Again, turning
So what is that, like earth
degeneration
resonance?
to regeneration. Yes, it's a lower hertz of the frequencies of nature. That when you lie in that field 8, 16, 24 minutes.
Do you have
once
one of
or
those
twice-
mats here?
We have like every single table.
Nice. I'd like to try that.
So when we give you your Myers cocktail or your Jumpstart, we are going to give you 8 minutes of pulse electromagnetic field that is going to allow your red blood cells to separate. And when that happens,
your blood flows better.
Right, because your red blood cells are not stacked. That's inflammation. You're getting oxygen and the goodness of life and even water into your cells, and you're detoxing. You're getting all that crap out of your cells.
Oh, I like that.
Yeah.
And the thing that I like is the capillus, which is the low-level laser light therapy, the red light therapy hat. I like those laser arrays. I wear it every day for 6 minutes a day, and when I don't wear it, I can tell. It has really thickened my hair up. I really love it. So, all right. So going back to the question about what would be the ultimate, if you could take the average guy who's got a bald spot in the back, receding hair, the average woman, I think, is thinning, more generally thinning.
Yeah.
That's what I see. And even not even middle-aged women. I'm tall and I look down on a lot of people. They're smaller than I am. I see young women with very thin hair. And when I see them, I say, first thing I'd do if I were you is get a capillus hat. The second thing I'd do is stop eating gluten.
Right.
Because I think it ruins your gut and it ruins your ability to absorb your B vitamins.
Exactly.
And also, I also wonder about the MTHFR genetic allele. They say somewhere between 15 and 30% of the population, depending on your ethnicity. Apparently, Latinas have a high, Latino and Latina people have a high amount of that genetic allele, that genetic mutation, but that is your inability to methylate the folic acid that's in most vitamins and minerals. And so being able to actually take a methylfolate, which is what people get from leafy green vegetables, but people don't eat enough leafy green vegetables. So having a methylfolate so you can help absorb your B vitamins, you need that to absorb your B vitamins, is really good. And people who eat a lot of pastries and breads and convenience foods, they're just getting folic acid that builds up in their system, and they can't absorb their B vitamins either, and so then they get hair loss because we need our biotin and our panthenol and all of those different things for hair. So,
but also, like, how many people that we test, testosterone, estrogen, progesterone,
low or off?
Low,
just low.
Very often low, or in some cases the estrogen dominance, which really
and
is
you're
not
talking
good.
men specifically. Or are you talking men and women?
Actually, both. And then we also look at, get thyroid, oxytocin. And then how about insulin?
Right.
Insulin is really important.
Yes.
Really key, because too high insulin and you're seeing that blood sugar shift, and that's inflammation, right? And that affects your cortisol levels. And so we have to look at adrenal health. And so really what I'm saying too is that so many people are stressed because their hormones are not balanced, right? Or they're stressed living in today's world.
Yeah,
Stress
it's
is
just
huge.
stressful today.
I'd have to say, by far, when I think about why people are losing hair more than anything,
it's stress.
Stress.
And it's just the stress of
and then
modern
the
life.
stress, right? That's affecting the hormones and then
this is
affecting
downstream
the gut.
effect.
Exactly. Exactly.
Yeah, it's overwhelming to live in today's world. So going back to kind of the optimal plan, you said that one shot at the hair lifts is going to get you going, but it might not be enough.
Right.
Are you thinking maybe 3 times, once every 6 weeks, once every quarter? Like, what's a good basic plan that could get, it's the 80-20, right? What's the 80% that's going to get you there? What would work for 80% of the people?
I would say 3 in a year.
3 in a year.
3 in a year.
And that's going to really kickstart follicular
if
energy.
It's pretty dramatic, like it's a huge shift,
Okay.
right? But again, it's an inside-out job. So we will always want to support our patients with supplements, with lifestyle suggestions, doing some internal work, like looking inside their homes, like what kind of toxicity is in your environment.
Are you sleeping next to your Wi-Fi?
Right. Very often they are. And
you eating bottled salad dressing.
Right. And then you think about the sensitivities to animal dander and dust mites and all that crap.
Chemical sensitivities, not even just the toxins and all of the chemicals in our environment, but chemical sensitivities.
And with substantial hair loss, we always want to do gut protocol. We want to get to the root of what's going on in there. Yeah, for everything that we do. Sexual health, hair health, face, all of it.
Yeah. I can't wait to talk to you about the vampire facelift or the PRP facelift.
Yes.
That's going to be in our next episode.
Awesome.
And thank you so much. I hope that you've enjoyed learning about the PRP hair lift to stimulate those follicles to start producing hair again, or to thicken up the hair that you already have. There's a lot that can be done. You don't need to have thinning hair because there are outpatient treatments. You're coming in, you're getting this done, you're going home with a greasy head of hair.
Exactly.
You don't look pretty when you leave, do you? Bring a hat, right?
Exactly.
Bring a hat and come see Dr. Robyn.
Right. We love doing hair restoration. It's so fun.
It must be exciting to see people's hair starting to grow back.
And just to say, you know, there's a lot of opportunity out there, but it's worth it to find somebody who's has a functional, integrative approach. You don't want these people who are just trying to sell you on, hey, buy these 3 hair lifts for this price, and they're not using a really good source for their PRP.
What do you mean source? You mean
in terms of we use a kit.
Uh-huh.
We use a really good kit to yield the maximum
What's
amount.
the kit that you use?
We use PRP solutions.
Mm-hmm.
Yeah, we use a very high-end one. Mm-hmm. And then we've used the M-Site kit for years now. And
that's how you process the PRP.
Exactly.
That's the machine that you're using.
PRP
to
Science,
extract
it's called PRP Science, is where we get our kits.
And that's to extract the PRP from an individual's blood. That you're going to take that broth and then you're going to inject it with your 8 circular pen scenario.
Yes.
Yeah, because I'm sure most people, when they're buying something like this, they're going in and they're just getting one needle and they're just sticking it in their head, and that's what they're charging for. I would imagine that's kind of the low end of the marketplace.
And something that's really exciting that we're adding to hair restoration therapies that we provide here are peptides. So it's an exciting field, this regenerative medicine.
It is.
Stay tuned.
Peptides are hot.
Every year, from hair to the OSHA, we have found ways to make it so much more comfortable. We've found ways to amplify.
Yeah.
We certainly are sharing ways to regenerate, to continue this regenerative lifestyle, to know the confidence of your regenerative potential in your body. I mean, we are powerful beings.
We are.
Our body is amazing.
We just sometimes our body needs to remember its own abilities to heal.
Yes.
And that's what you're really doing, is you're like, hello, you remember this? You remember how you used to like to grow hair? Here's some good energy and healing that you can use to grow some more hair again.
And we can grow biologically younger.
Yes.
Like a yoni after having 1 or 2 O shots. Oh my God.
Yeah.
Like these women come
You feel
back
35
and they
instead of
look
55.
so much younger. The tissue is ripened. It's pinker. You can just see that the gravity, even when you look at the labia majora, because there's something that we do called the wing lift too, that restores vitality. So it's not just hanging.
Yeah.
Gravity's not winning anymore.
No more gravity. We're going anti-gravity.
Right.
Anti-gravity matters.
Yes.
All right. You got to hear from Dr. Robyn Benson at Santa Fe Soul all about this hair restoration technology and treatments that are available to you. I'm Susan Bratton from the 20, and I'll see you on the other side.